Now, according to the New York City Health current statistics, it showed that 47.7% of all the deaths of the people who have died in New York, they were 75 years and above. And if you compare that to the people who are below 17 years old, is 0.04%. So these statistics show that older people are more vulnerable as compared to younger people. Now, there have been some conflicting information on how long the incubation period is. And basically, the incubation period is the time when you get infected to the time when you start experiencing symptoms. The symptoms I've named above. And the general figure is that when you get infected or exposed to the virus, it can take 2 to 14 days to start experiencing symptoms. And for some people, it might take even longer depending on your immune system. And it has been found out that some people might not experience any symptoms until maybe a month. For some people, it's 19 days, which it's approximately 3 weeks. And for some people, it's within 24 hours to 72 hours, which is approximately 3 days. And for some people, it might take a week, which is 5 days to 6 days. So basically, if you get exposed, or if you suspect that you've been exposed, if you don't feel any symptoms for any number of periods, don't assume that you have not been infected by this virus. You might be a carrier, and the symptoms might display later. So to be safe, just make sure that the moment you suspect that you've been exposed to the virus, isolate yourself so that you can be able to protect those you love and your friends and anybody that you stay close to in order to save lives. Now, according to the CDC, people with COVID-19 have a wide range of symptoms that have been reported all over the world. And these symptoms may appear between 2 to 14 days after exposure to the virus. And some of the symptoms you may feel is fever, cough, shortness of breath or difficulty in breathing, chills, repeated shaking with chills, muscle pain. And muscle pain, it might be on your legs, in the shoulders, on your hands. You may feel headache that is equivalent to a migraine, a sore throat, and you may end up losing the sense of taste, meaning you might not be able to distinguish between different tastes, and also the sense of smell, whereby you may not be able to distinguish between different types of smells. Now, some of the typical symptoms, meaning symptoms that are common in almost everyone, it's a fever and a cough. So basically, these are the first things you start feeling the moment you get exposed to the virus in a few days. Then in some patients, especially the elderly and those with chronic health conditions, develop pneumonia with chest tightness. It feels like something is pressing against your chest. And then you end up having chest pain and shortness of breath. And it seems to start with a fever followed by a dry cough. And after a week, it can lead to shortness of breath. And 20% of the patients, they require hospital treatment. And this is where they have to be put on the machine to help them breathe. And this is one of the most important things that we have to notice, that in most cases, COVID-19 infections, they rarely seem to have a runny nose or sneezing or a sore throat. And if you end up having some of these symptoms, it might just be signs of a a common cold or flu, and it might not be a COVID-19. Now, some of you have been asking, do I have a pre-existing condition? And if I get infected by this COVID-19 virus, will I end up having severe symptoms? Now, the results have been different across the world. According to the CDC, it has shown that there are some people who had pre-existing conditions and they survived, while in most cases, people who had pre-existing conditions have developed severe symptoms. And if you had a pre-existing condition such as the cardiovascular disease, diabetes, chronic respiratory disease, hypertension, you might be at risk of developing severe symptoms. So to be on the safe side, make sure you follow the guidelines that have been put out there to protect yourself against this virus by social distancing from people that you might suspect that they are infected by the virus. Wash your hands with soap, and make sure you clean any surfaces that you might come in contact with, such as doorknobs, tables, and also wear a mask when you go out, just to prevent yourself from being exposed to any droplets of the virus in the air. Now, at the moment, we know that there is no vaccine for the COVID-19, and many doctors have recommended that boosting your immune system can help you fight the coronavirus, whether you're not infected or whether you're infected. And there are several ways in which you can do that. Now, there are basic things that you can do to protect yourself from getting infected by the COVID-19 virus. And one of them, most important thing, is proper hand washing with an alcohol-based sanitizer, which is at least 60% for 20 seconds using soap. And this is one of the most important basic things that you have to do on a daily basis whenever you go out or whenever you come in contact with any material that you think might be exposed to the virus. Second is don't smoke. Smoking will increase the chances of you developing symptoms, especially in your lungs, because we know that this COVID-19 is a respiratory disease that attacks the lungs. So please don't smoke. And if you're a smoker, you can try to reduce the frequency of how many times you smoke per day. And then the other thing is get adequate sleep. Sleeping basically says that it helps boost your immune system. So basically getting a good night's sleep, it's very important. And this is something you can do by setting your clock and sleeping at least 8 hours of getting at least 8 hours of sleep. The other important thing is to get the right amount of exercise. And I know during this time of the lockdown, it might be difficult for some of us to exercise because we're always sitting at home watching TV and maybe sleeping throughout the day and throughout the night. But exercising is very important, and we can do this by walking around the house, doing push-ups, doing sit-ups, making a few walks around the compound if you stay in a big compound. And some people they do some of these exercises in the kitchen or in the bedroom. So wherever you are, you have just to remain fit, because being fit is very important. It says that when you're busy moving around, it helps to boost your immune system for the body. But if you stay in one place for a long time, that's when you get sick. So it's important. And one important thing is that because many people are infected with the virus and we don't know who is infected and who is not, don't go to the gym, because some of the surfaces in the gym, like the push-ups, the dumbbells and all that, they might have traces of the virus. So the best thing is to do it at home, and it's very simple. Find something that can keep you active during this lockdown. Well, another factor to put into consideration is stress management. How you manage your stress is very important, especially during this time of the COVID-19 pandemic in the world. And many people are stressed about many things, about how they are going to pay their bills, such as rent, how they are going to buy food. Are they going to get infected by the virus? Are any of their loved ones going to be infected by the virus? Are they going to lose someone in their lives? And many other factors that increase the stress. And according to research, it has shown that many people who have stress, they end up having a low immune system. We learned that stress releases hormones in the body that end up being natural killer cells. They kill cells in your body. And these cells, they are usually the first responders of our immune system. So during this time, to be on the safe side, let us manage our stress. And we can do this by doing things like meditation, mindfulness exercise, getting outside and going for walks. And these are some of the examples in which we can reduce our stress. And for people who try to use other means to manage their stress, such as maybe drinking alcohol, taking drugs, overeating. These are some things that can make you vulnerable to the virus. So to be on the safe side, please manage your stress. And you can find different ways in which you can manage your stress. You can search online and you might find different ways in which you can do that. Or you can call a friend to come and console you. And if you have a problem, don't keep it to yourself. Talk about it. Call people that you know, because this is something that can lead people even to commit suicide. So it's important that we manage our stress so that we remain on the safe side. So in summary, the reason that this coronavirus is spreading so rapidly and having such a significant impact on the world around us is because of the immunity. We learned that many people who have died is because the immune system is low, and our immune systems have never experienced this virus before. It's a new virus, and most of the people, they are trying to adjust to it. So the most important thing we can do is to keep ourselves healthy and better, and we can do this by having good hygiene. We can social distance and help to prevent catching the virus, or help prevent other people from getting the virus from us if we are infected. And even if you don't become exposed, your overall health might benefit from eating a nutritious